Good morning. My name is Emily. I'm going to be your host today. Can you tell me your name and date of birth, please?
Emma McClellan, 1225, 1997.
Alrighty. I'm going to be checking your vital signs today and doing a health assessment. Do you have any questions for me before we start?
No.
Alright. So I'm going to start off with your vital signs. Put this on your tongue for me and hold it there.
You'd be hangry, that's right. Okay.
Temperature is 97.9. Oxygen level is 99 and your pulse is 69.
Cry in the middle of the field. My dog's like sweating back and forth. Yes.
Take your blood pressure out.
No, like when you don't, like you lose like your common sense. I feel like that's
You have a psychotic break.
Yeah.
And then would you bargain like with yourself?
Like, I do anything.
Yeah. No, I would be like.
Alrighty, I got 122 over 70.
Because I have like Caroline.
I'm going to check your pulse now.
Put her on a leash. She like escapes out the door somehow. It's never me though. So the first thing I do is lash out on whoever got her let her out.
So you become very irritable,
Yeah.
right? You're upset, you're irritable, so you're going to take it on somebody else.
Yeah.
Okay, so, and of course, what can I not live about? I can't with my children, but the one thing that I did 1 year was I actually, during
Alright, respirations are 14 and your pulse was 82. Do you know where you are right now?
Germana Community College.
Right. If you'll hop down from the bed, we'll actually do your height and weight.
So it goes through, I'm thinking everything's functioning, what I need to do. I have some, some green tea, so that's where I call them green tea. By the way, tell them green tea, I thought that was great. So, but at the end, when Easter arrived, first thing that we did was cup of coffee by myself. They said, "Cute."
Go ahead and step down. Do you have any questions about your BMI? We talked about it last time.
No.
So your speech is good. Level of consciousness, you're alert. No indications for the Glasgow coma scale or the mini mental exam. Can you raise your hands up for me? And can you pull and push? And then can you grip my fingers? Alrighty. I'm sorry, you're gonna hate this. Can you press down on my hands and can you pull up? Alright. So grips and plantar flexion are equal bilaterally. I talked about your speech. It's clear. I'm going to start assessing your head now. Do you have any pain?
No.
Tenderness?
No.
All right. I don't feel any lumps or bumps. The hair is distributed evenly. Your eyes are symmetrical in position. I'm going to shine a light in your eyes if you could just look right here.
This is a group of men I work with.
All right, pupils are pearl. I said your eyes were in alignment and they're symmetrical. Can you pull down on your sclera is white, conjunctiva is pink. Pupil size is about 5 to 6 millimeters, I would say. Do you wear glasses or contacts?
Both.
All right. When's the last time you went to the eye doctor?
In April.
In April? All right, awesome. All right, so going down to your nose, that is symmetrical in the middle of your face. Can you occlude one there for me? And can you include the other there? All right. Can you look up for me? All right. Nasal mucosa looks pink and moist. Can you close your eyes for me, please? And can you smell? Do you know what that is?
Alcohol.
All right. So your smell is intact. I do not see any lid lag, drainage, lesions on the eyelids, no ptosis. Let's see, let me check your ocular fundus. Can you look straight ahead for me? Visualize the ocular fundus at cranial nerve 2. Do you have any pain on palpation?
No.
Do you have any difficulty hearing?
No.
Any excess wax that you've noticed?
No.
Can you cover your right ear for me? I'm going to whisper a word if you could repeat it out to me. Broccoli.
Broccoli.
Yes, correct. All right, I'll go to the other side. If you could cover your left ear.
Apples.
Correct. Alrighty. So the whisper test is intact. I will now look at your tympanic membrane. Wow, these ones are big. Let's do this.
So, let's see what we just talked about. And we're going to expand on it, all right?
Alrighty, your tympanic membranes are a pearly gray.
I didn't know that it was already done.
I do that every 2 years. I know. So,
What? Alright, your lips are moist.
Oh, this summer.
No ulcers or cracks noted.
Never mind.
Can you smile for me? And can you stick out your tongue? That's cranial nerve 8, 12. Whisper test was cranial nerve 8. Okay, so your teeth are in alignment, gums are pink and moist. How often do you brush your teeth?
Twice a day.
Can you stick your tongue back out for me? Alright, uvula and tonsils are in place. No lesions inside the mouth. Oral mucosa is pink and moist. Can you swallow for me? Actually, while you're doing that, I'm going to test your thyroid so you only have to swallow once. Alright, swallowing is intact. Thyroid is in place. So with that, we will move on to palpating your lymph nodes. So we have your preauricular, postauricular. We have your parotid, your occipital, your retropharyngeal, submandibular, submental, posterior cervical, anterior cervical, and subclavicular. We tested your first cranial nerve smell when you smelled the alcohol. Ocular fundus was cranial nerve 2, cranial nerve 3. Let's do that one. All right. Can you follow my pen light for me?
Plays into it.
Okay, that would be cranial nerve 3, 5, and 6. And you smiling at me was cranial nerve 4 and 7. Cranial nerve 8 was by the whisper test, and 9 was swallowing. Alright. So your skin appears pink and dry and warm. Have you noticed any abnormal vascularities?
No.
Alright, I don't see any edema. Capillary refill is good. Don't note any clubbing. Skin turgor is good. Okay, no more. Can you lift up your arms for me? Alright. Axillary lymph nodes are fine. How often do you shower?
Twice. Every 3 days.
Okay, I'm good.
Twice.
Twice a minute. So we tested your oxygen saturation already. Your breathing pattern seems normal. No trouble breathing or anything. Can you take a deep breath in? Alright, we have symmetrical chest rise and fall. Can you sit up for me? And can you take another deep breath? Alright, good. Do you have a cough?
No.
No? Any shortness of breath ever?
No.
Alright, I already said we have symmetrical chest expansion. Can you say 99 for me?
99.
And again,
99.
one more time.
99.
Hold on, in front of you. Can you say 99?
99.
One more time.
99.
Alright, tactile fragmentus intact in all fields. So let's go ahead and percuss you now.
The reason is because there are populations that consider fingers
Alright, I'm going to come around to the front of you and do the same thing.
to me about 20 years ago. When I was submitting a patient.
Alright, sounds good. Now that we've percussed, I'm going to go ahead and listen to your lung sounds. Come over here for me. Take a deep breath. One more time.
And I said, oh. And I said, so you just don't want to get the fear things and hold down. They literally consume. Okay. So I was like, okay, well, you think about that, whatever, but then you have to look at what the use is. My grandmother's told me that.
Do the same thing.
Right, so you need to understand what they're drinking, how much they're drinking, and you need to figure out what that means. So if they say I drink a 6-pack of beer a day, what does that mean to you?
Alrighty, go ahead and sit back. No adventitious sounds were auscultated on the lung fields. We did have the normal bronchial, vesicular, and vesicular sounds. Do you have a history of smoking, ma'am?
No.
Alright, so we will go ahead and go on to the cardiac then. I'm going to start listening to your chest again.
How much, how many ounces? So what's your next question? What is it? What kind are your beers? Yeah, what kind of beer do you drink? Does that play into it? I mean, is your Bud Light the same amount as your Budweisers, or your Guinness, or your IPAs?
Go unface your shirt.
Yeah, so you need to understand what they're drinking, how much they're drinking. So if they say a 6-pack of beer a day, you can say.
Alright, now I'm going to listen to your necrocolada brews.
We just got someone admitted like on Monday, where I've done this simulation for a while, for my said.
So we had normal S1 and S2 sounds, no extra sounds, no carotid breweries, no murmurs. So I'll go ahead and palpate your pulses now. You got your temporal pulse here, half of the carotid pulse,
6-pack, 12 ounce.
other half of the carotid pulse. Is here on.
She said you drink
Got your brachial pulses here,
She said, well, that's the first time.
and your radial pulses. Alright, femoral pulses are inside the groin, so we'll skip those for now. We'll go to the popliteal pulse.
I thought the top one was like 24. What was it?
It looks good. We'll do the posterior tibialis. And then the dorsalis medius. Alright, all pulses are equal bilaterally. I don't know any edema. Capillary refill, as I said before, is good. And you have good color and temperature of your skin. Alright, do you have any difficulties chewing or swallowing? Any history of indigestion?
No.
Thanks, ma'am. While you're reclining, how's your diet? Do you feel you eat a normal diet?
Good.
Do you eat 3 times a day about?
Yes.
Snacks in between? Normal fluid intake?
Yes.
Have you had any changes in your appetite recently?
No.
Any recent weight loss or gain?
No.
And any problems with diarrhea or constipation?
No.
Alrighty, so I'm going to lift up your shirt. And first we will inspect the abdomen, looking for any distension, lumps, bumps, any shadowing. I don't see anything, so we'll go on to auscultate next, starting at the left or the right lower quadrant and moving around.
Don't leave them. But don't leave them. Don't say, so when you get to the morning, you should prepare. Just like, when you start working. All you can ask them, when was the last consumption of alcohol? When was the last time you had a drink?
We've got active bowel sounds in all 4 quadrants. I'm going to go ahead and press on you a little bit. Let me know if anything hurts.
Very good. So, you want to think, but then let's say they keep you with nausea long enough. Okay? We woke up in the morning.
Any pain or tenderness there?
No.
And then they threw up. Is that the last
Pulsations. I also need to percuss your abdomen. So I'm gonna come back here.
I said they're hungover.
We have tympany over the hollow organs and dullness over the solid organs.
Right, so 16
Good for you. Okay. If I can go ahead and have you stand up, I'm going to test your posture, balance, and gait. Do you have a history of falls?
No.
Ready? Can you go ahead and lift your arms out for me and raise them up and down? And can you bend your elbows up for me? All right, awesome. Do you have any problems with moving any of your limbs?
No.
Can you lift one knee for me and then lift the other one? Any problems you've noticed ever with your balance?
No.
All right, I've noted when the patient stood up to walk to the scale that her posture was good, a good stance, strong gait with a good swing. Can you bend over for me? I'm going to look at the curvature of your spine.
All right, so tell me the admit help. When someone walks into the emergency.
All right, looks good. You can stand up for me. All right, we have muscle tone and strength I tested with the grips and the flexion, 4+ with no weaknesses. Can you have a seat on the bed? I'm going to test your reflexes. Can you go ahead and flex for me? All right, and you can relax it.
Oh, that's wrong. Oh.
Can you flex again for me?
So, yep, elevated
All
heart
right.
rate. Elevated blood pressure. Elevated blood pressure.
Okay, good. Good stuff, Ian.
Not yet.
All right, can you swing your legs over on that side? Can you straighten your leg for me? And release.
They're not febrile, they have like.
Okay, good. Can you straighten this leg for me? And put it back down?
So if you have a high heart rate.
And test your Achilles tendon. Can you lift your foot up? Good. And relax a little bit. Okay, good. And lift your foot up again. Relax a little bit.
Blue?
Alright, good. Have you ever noticed any problems with your reflexes?
No.
Your balance was good. Do you have any problems with your activities of daily living ever? Do you have trouble walking, folding laundry, putting away dishes?
I do all those things myself.
Okay. Do you ever have a sensation of pins and needles, numbness, or coldness in your extremities?
No.
You can go ahead and lay back down for me. Do you have any problems with urinating, any burning, or difficulty urinating?
No.
Are you sexually active?
Yes.
Do you have any problems with your menstruation? Is it normal?
It's normal.
It's normal. Alright. Are there any cultural or spiritual concerns I should address?
No.
No. If there were education points, I would educate the patient on those points. And do you feel that at this stage in your life you've completed everything you've needed to complete?
Yes.
Alright, is there anything else I can get you today?
No.
Alrighty, the doctor will be in with you soon.
Thank you.
Because